Two medical journals have published reports this month presenting assessments that support the claim that SARS-CoV-2, the virus causing COVID-19, spreads through airborne transmission. In an editorial released by the British Medical Journal, it noted that people infected with the virus produce many small respiratory particles which contain the virus as they exhale. That is why it emphasizes the need to improve indoor ventilation and air quality, as suspended particles can remain airborne for hours, adding that people are much more likely to become infected in a room with poor ventilation. Meanwhile, a report from The Lancet presented 10 scientific reasons in support of COVID-19's airborne transmission. These include patterns of long transmission in super spreading events and between people in different rooms in quarantine hotels. It also suggests that almost half of all transmissions globally could be attributed to asymptomatic or pre-symptomatic transmission of the virus from people who are not coughing or sneezing. Another is that the virus has been detected in the air and could be stayed infectious for up to 3 hours, and that SARS-CoV-2 has been identified in air filters and building ducts in COVID-19 hospitals with COVID-19 patients. According to former IATF advisor Dr. Tony Leachon, the government should look into the reports immediately.
Again, dapat mabilis na yung ating mga kilos ngayon. Kasi, again, this is something na urgent eh. Sinasabi ko, yung vaccination program is a super spreader event. Dapat mag-ingat tayo. Dapat mag-ingat kayo sa room sizes, sa ventilation, mga LGU. Dapat asikasuhin ho ito.
The country's World Health Organization representative says they are studying the reports but maintained that this could be prevented through minimum health standards.
We still recognize that this is not a big risk factor. We have to take it in the context of relative risk. We continue to emphasize that the aerosols generated, whether it's through talking, coughing, or sneezing, can be controlled by the wearing of masks.
For its part, the Department of Health says the current health protocols are enough.
So we have our existing protocols already. Aantayin po natin ang rekomendasyon pa rin ng WHO. Sa ngayon, pinag-aaralan pa rin po yan. Pero whatever we are doing right now, I think is appropriate and sufficient to protect the public.